and thank you all for joining us today. As Kyle said, my name is Dion Powell, and I have the pleasure of being General Counsel and Chief Legal Officer here at Philadelphia Fight. Today, Levada Washington couldn't join us due to an unanticipated illness. We send her our well regards and good wishes for a speedy recovery. But undoubtedly, if she were here, she would tell us all about her years of service as a member of the Philadelphia Fight family. She would undoubtedly mention that she's also a member of the Philadelphia Fight Board of Directors, and currently she holds the position of the Vice President. I know Levada, and she would mention to you that she's so excited to be here. She's always smiling, always motivational, and always inspiring. And she would have done a much better job than I at this. But I want you all to join me in sending her our warm, wishes for a speedy recovery. And nevertheless, it's my pleasure to welcome you to Meeting People Where They Are, Philadelphia Fight's inaugural Health Equity Speakers Series. As we all know, April is National Minority Health Month. It's a time for us to raise awareness about health disparities that persist among racial and ethnic lines. Health inequities began even before birth, simply because of an individual's race, ethnicity, family income, place of residence, or other social locations that create an inability to access affordable health care. Such disparities end up leading to unnecessary doctor's visits, social and economic costs untold, as well as a reduction of lifespan and a quality of health. Fight has always been a champion for the underserved in this respect. Today, I want you all to remember that we were founded as a research grant for minorities and enabling them to access HIV clinical trials. It was people of color, Black folks, Latinos, children, pregnant women, all of whom were historically excluded from HIV trials. Philadelphia Fight knew differently. A few years ago, our mission was further emboldened as we became a federally qualified health center. With that designation, we're able to provide healthcare to folks, healthcare to all, despite their ability to pay for it. This year, our inaugural health conference, the theme is Meeting People Where They Are, and it acknowledges Fight's continual role in the fight to advance healthcare priorities and issues of health equity for those who we cater to. Today, we're going to focus on leading. There are 4 goals to this speaker series: to lead, to uplift, to educate, and to galvanize. Today, we're leading the charge for health equity with the conversation with my colleague, the new Director of Adult Medicine at Philadelphia Fight, Dr. Annette Gadegbeku. Next week, the plan is to uplift Black women's narratives. We're going to have an exciting presentation about treating this disease called strength. And we're going to examine the implication of the social perspectives of women of color who all too often have been seen as the pillars of society without really being given an opportunity to take care of their own mental health needs. There's an esteemed panel for that presentation that will discuss Black women, mental health issues, and present the audience with ways that we can treat trauma and address this issue of what we call strength. The third series, we're going to educate. We're happy to welcome Jacqueline Romero, who will give a presentation from the U.S. Attorney's Office about how to combat HIV discrimination and discrimination against those who are demonstrating problems from the opioid epidemic. And finally, the 4th installment of the series will be Galvanizing Communities for a Healthier Tomorrow. During that series, we'll be joined by Charlene Flash, the CEO of a federally qualified health center down in Texas. So as my mother would say when she would give her church announcements, if you cannot make them all, please don't miss them all. So now it is my distinct pleasure to welcome you and to introduce you all to Dr. Annette Gadegbeku. Dr. Annette Gadegbeku is joining Philadelphia Fight and in the inaugural role as the Director of Adult Medicine. So let's all give her a virtual round of applause as we welcome Dr. Gadegbeku.
Thank you.
Dr. Gadegbeku, let's get straight to the point. We're all excited to see you. We're all excited, for the opportunity for you to join us. Can you do us a favor and just tell us a little bit about your educational background and your professional background?
Sure. So just a little bit even about me. I'm originally from North Jersey, but I've been here in Philadelphia for the last 21 years. So I've definitely translated my Jersey girl card to my Philly girl card. And I came here to Philadelphia to train for medicine. I did my medical school education at Temple University School of Medicine, and I did my residency training at Thomas Jefferson University Hospital in family medicine. And after that, I directly went into residency education and was faculty at a community family medicine residency program in Montgomery County, Montgomery Hospital in Norristown for a couple of years. And then I came back into the city and had been with Drexel University College of Medicine for the last 11 years since 2009. And I did my undergraduate education at Brown University in Rhode Island.
Wow. So, I mean, I'll just, cut straight to the chase. With a resume like that and a CV like that, all of us want to know, why Philadelphia Fight?
Sure. Philadelphia Fight is an awesome organization. The mission aligns with my mission of what I want to do in my career. And Philadelphia Fight has done an excellent job with supporting, advocating, and bringing great health care and programs and support to those living with HIV, and now expanding to general populations from children, adolescents, and their families, adults, those needing all kinds of care. And I'm so excited to join the team and learn from all that you've done, because you've done an excellent job, and continue to bring whatever I can to expand services, programs, education, advocacy for all people, all walks of life, those having all kinds or needing all kinds of care at this time. So that's why Philadelphia Fight.
And that's really exciting to hear. And I mean, I just can't say enough how excited we are to have you. You mentioned a few things, and I wanted to orient the audience a little bit. Some of the things that you mentioned really get to the heart of what it means to be in community care. Would you agree with that?
Yeah.
And I think that a lot of lay people understand, or have their own definition of what community care, community health is as a specialty. But can you just give us, from a clinical standpoint, from a medical standpoint, what exactly is community health as a specialty?
Right. So community health definitely is my passion, my focus. And it really is simply what it says, the health of community and communities. And we all have very different understandings of what community means or community is. Traditionally, we think about communities as, where you live, neighborhoods, but it definitely can have a greater definition. Communities are connections of people, groups of individuals, many times around a common interest or a common issue or a common goal, or have many similarities, maybe where they, like we said, where they live, some of the health conditions they may have, maybe a community. And now in our virtual age, our community expands beyond just neighborhoods. So it's really a unity and connection with people. That's what community is. And health, health is all the things that determine someone's well-being. And health, really, the health of an individual, the health of a community goes way beyond just health care and healthcare delivery, what we think about it. Actually, when we think about the determinants of health, it's only about 30% that really is related to health care as we know it. So the health of the community is really determined by where we live, where we've grown up, where we work, where we play, our physical environment, social, political, ethnic background, so many factors that go into what really determines our health and our wellness. And so bringing that all together with people and addressing people, as this title says, meeting people where they are, meeting them where their needs are. And I've just always been someone who just gravitates towards what people may think of as the least of these, those who are marginalized, those are vulnerable populations, those that have poorer health and wellness. And so when I think about community health, it's really about being aware of and addressing those things, those needs, those factors that really determine health, other than just healthcare delivery. And so, yeah.
Thank you so much for that answer. And I think that it encompasses a real expansive view of community health that I think that Philadelphia Fight shares. And I think that that's demonstrated in the fact that today we have over 150 folks who signed up for this webinar. You know, when you think of community health, often people think of underprivileged, they think of underserved. But, you know, I think that you hit on a few points that the community health family extends far beyond folks who actually necessarily need your care, right? Because I mean, even don't necessarily need care from Philadelphia Fight, more than likely you know somebody who does, right? So, you know, and I wanted to piggyback off that because in 2013, Philadelphia Fight was granted its designation as a federally qualified health center and a community health center, you know, so it really does place community health firmly into what we do, into who we are as we transition from the AIDS Services Organization that we were founded as, 30 years ago. So, thank you so much for that response. And I wanted to dig a little deeper and ask you more about Philadelphia Fight. What brought you into this orbit? Was there somebody that you knew? What really put Philadelphia Fight onto your radar?
Well, I have to give a big shout out to Dr. Mario Cruz. Dr. Mario Cruz definitely put this position on my radar. I've known about Philadelphia Fight definitely throughout my career and what I've done in Philadelphia in the community. But it was Dr. Mario Cruz who alerted me to consider coming on board to join the team. We had worked together at Drexel, and he was a physician at St. Chris, and me with Hahnemann and Drexel, and definitely have been colleagues in the charge for community health and education of our students and residents in health, community health equity. And he thought it would be a great thing for me to maybe come on board, and definitely met wonderful people like yourself, Dion, and Dr. Truskin, and a lot of the providers and some staff, and just really spoke, as I spoke with them, it spoke to me about what has been done, what you all are doing, and where you all are going, and really want to be a part of that and bring others and other support and partners into the work that we do here at Philadelphia Fight, and bring education as well for those who need to come on board now or in the future as potential or future healthcare workers, healthcare professionals in the future.
For sure. I mean, yeah. So I like what you said. In speaking to them, it spoke to you. I think that that's a very nice, way to encapsulate all of that. And yeah, Dr. Mario Cruz is a superstar here at Philadelphia Fight. For those of you who don't know, he's the director of our pediatrics practice. And Dr. Stacy Truskin, who you also mentioned, is our chief medical officer here. And, I know that there was a huge concerted effort on all of our parts to kind of woo you, because I mean, to be honest, when it came up, I said, there's no way that we're going to convince Dr. Gadegbeku to join us. And, not that we don't recognize the talents at Philadelphia Fight, but I think that there are a lot of folks who just don't know what a gem we have here, and, a lot of the synergy and a lot of the energy that we have going on. And so your response also speaks to another thing, which is, is Black excellence, and you tend to draw, motivation, and you tend to draw things from one another. And it's a lot of opportunities for doctors of color to really engage folks with Philadelphia Fight. And that's something that we're going to talk more about, at length. So again, a big shout out to Dr. Mario Cruz, a big shout out to Dr. Stacy Truskin, who, really went far and beyond. I can just tell you a little backstory. When this was all happening, Dr. Truskin, she would text me and she said, Dion, we got to make this happen. We got to make this happen. There's a lot of, concerted effort. We've got folks from Drexel, we've got folks from Tower, we've got contracts that are going back and forth. And every time we felt like we were getting to where we wanted to be, it was just something else that would come up and Stacy would say, we got to get on top of this. And I can remember a couple of weeks ago, I was, on standby for a phone call that she was having with general counsel there with another issue that I wanted to talk to you about. And, from what I know, you are going to retain your deanship at Drexel College of Medicine, right?
Yes. So I am coming from academic medicine background. And so this is a little bit different, but also the same. I also was the medical director at one of our center city sites for our family medicine practice. But I am faculty. I am associate professor in the Department of Family, Community and Preventive Medicine in the College of Medicine at Drexel. I am also division chief of community health in the College of Medicine, and I am assistant dean of community health in the Office of Diversity, Equity, and Inclusion in the College of Medicine. And I will be retaining those positions. And I hope to continue to build on community health in partnership with FIGHT. I hope to strengthen some partnerships in both institutions and other organizations in the community in Philadelphia, and also continue some of my educational efforts in community medicine by being at FIGHT. I can definitely help to bring curriculum as I have and experiential learning experiences for students, residents, pre-health students. That means can be medicine and other health professionals that are affiliated with Drexel. And not only just to be with me, but be with the multiple healthcare providers that you have across all your 4 sites, for people to really learn about this Philadelphia Fight actually is what I teach about, what I've taught about for the last 13 years. And I remember that was kind of one of the aha moments I had when I was considering this position. Like, this is wow, like this is what I want my learners to know about, to experience, and to eventually do. No matter what they end up doing in their careers, there's always, I believe, room for community health and giving back in whatever way that you can, inside and outside of your 4 walls of your practice and inside and outside of what your general job description is. You guys have such a collection of providers, services, programs, and these are the things that I wanted my learners to know about, to teach about, and to experience, and maybe even get excited about doing in their future careers.
When you mention, your students, your learners, I just want to orient that audience a bit. So we're talking about pipelining, right? I was excited to see that as a part of your responsibilities as the dean through the Office of Diversity, Equity, and Inclusion, you're going to be working on pipelining. And the goal is to bring as many talented students to Philadelphia Fight for experimental learning as possible. And inherent in that, is also people of color. I want to talk a little bit about that because, your resume makes clear that that is something that you've always been very firmly grounded in. And the conversation that you and I have had, made me more excited about the possibility of working with you because we see the world very similarly and with regard to, diversity, equity, and inclusion. So talk to us a little more about that, hone in on not only the experimental learning that you're going to be bringing for the students, but what is the role of D&I in that kind of component of what you're bringing to Philadelphia Fight?
Sure. So in the diversity, equity, and inclusion role, I definitely will be fostering, again, community. Everything has to, is synergistic and in line. And support, one of the things I do is definitely support our students of color in mentorship and guidance of getting through the journey of getting to what they want as their desired career in health professions, particularly in medicine. But it also starts very early. And I think that's one of the things that is lacking, particularly for our students of color. And I'm talking about even as early as elementary, middle school, high school, and who really has access to seeing what healthcare looks like, or even the possibility of being a healthcare professional. And seeing people that look like me and you. That's one of the main reasons why I'm here today. What I do is I just wanted to be here for those who look like me, and let them know, like, you can do this too. And because we definitely have a lot of messages from very early on that this may not be possible for you. And I want just to be an ocular demonstration that it is possible. So even just being in the office of diversity and inclusion is huge. As a dean, I never thought I would be an assistant dean one day. That was not on the radar, but God had plans. And through that role, just bringing learners, students from whatever we can as early on to just experience, have the opportunity to be even around in that setting and know what's possible. And then also formal, rotations or curriculum, or we call them service learning opportunities in your programs, or just shadowing opportunities, or actually rotations in curriculum for students, residents, fellows. And what the hope is, like I said, that they'll be galvanized and energized and excited about doing something like this, so we can increase the healthcare workforce that is diverse. And it's so important to have the healthcare workforce reflect the people it's serving. And just trying to bring people maybe in through that door, from very early on, experience what it is, get excited about it, say, yes, I want to do this, and give them opportunities and support and mentorship, sponsorship, and allyship. Those are three very important things that we all can do, no matter who's on, what your role is. Those are all things that we can do to kind of bring more people of color into the healthcare workforce to serve communities like the ones we serve at Philadelphia Fight.
You said something that jumped out to me, and it's, if you can't see it, you can't be it, right?
Right.
And so that leads perfectly into the next question that I wanted to ask you, and it's a two-parter. Why does representation matter? I think that you are perfectly equipped to answer that question from a clinical standpoint first, and then, from an ethical standpoint, just to reiterate some of the things that you already said. So why does representation matter from a clinical standpoint and from just an overall ethical standpoint?
We just do better. Everybody does better when they have care from people who know the experience, who look like them. There are actual studies that show, particularly in African-American communities, that, African-Americans, Blacks have better health outcomes when they have providers in their care that are also African-American or Black. And there are many things that speak to that, or many reasons why that is. It speaks to the mistrust, or more, it helps with trust, gaining trust. And when you gain trust, people are more likely to adhere to the recommendations that you have for their health. And then again, we, probably for reasons known and unknown, again, we just do better. And so it's important that we have healthcare providers that look like the populations they serve. And it's not just only for Blacks and African Americans, it's for all minority, all people of underrepresented minority groups. And what you might define as that, that includes race, ethnicity, and also gender, sexual orientation, all of those factors, because we do better.
Right, right. You know, one of the things about healthcare and medicine, which really attracted me as a lawyer, is that there are demonstrable studies that show, you know, that people of color, like you said, have better health outcomes when their providers are also people of color, or when there are things that they can relate to. You know, it's very hard in other disciplines and other professions to convey that, you know, in this society where folks talk about being a race blind society, you know, not seeing color. But again, medicine is one of those areas where the studies have shown that there is a dollar for dollar connection between health outcomes and the folks, you know, who are treating them. So I like to say, you know, that we're getting a twofer with Dr. Gadegbeku. We're getting an esteemed clinician and somebody who sees the world, you know, a lot like me and my colleagues here at Philadelphia Fight. You know, which leads me to you know, to want to ask you some questions about the particular role, you know, the role of the Director of Adult Medicine. For those of you who don't know, this is an inaugural role. We've never had this position here at Philadelphia Fight. And from what I understand, you're going to be overseeing clinical operations at two of our busiest and most robust health centers. The John Bell Health Center, which is primary care and very much affiliated with our Institute for Community Justice, and the John Lack Center with the Jonathan Lack Center, which is our infectious disease clinic. You know, what is the charge? The title of this presentation is Leading the Charge for Health Equity. You know, what is the charge and what are you going to do to lead it?
The charge is to provide excellent, comprehensive care for all people. Really, I want to expand with my teams, you know, the services that we're already providing and add more, and make sure that we are all operating at the highest level of excellence to provide the best care for all of our patients and all of those who we serve. And I want everyone to know how valuable each and every one of them is to this role, and to our success in this. Everybody has a particular role and position, and even those that are not maybe embedded in the health centers. I know that there are many community partners and those on this webinar, and whether it's in a whatever supportive role, but we're all kind of in this together to give the highest level of care. And that's what health equity is, achieving the highest level of healthcare possible. And that's what I'm here to do. And I cannot do it on my own, by myself, definitely. And I'm actually overwhelmed by the amount of people and programs and services that are here to lead the charge with me. And we're all in this together. And that's the charge, just excellence, comprehensive, the highest level of care for all people, children, adolescents, adults, elderly, and those with that are healthy and those that are not so healthy, but we're here to get them to what they need to have for their health and their care.
That's fantastic to hear. I mean, you know, there are 13 providers between those two clinics. There are 2,000 patients, I know, at the Jonathan Lack Center alone. You know, that it seems like a huge undertaking. You know, what do you see so far as being the rose, and what do you see as being the thorn of leading something like this?
The rose is definitely all the wonderful people I'll be working with, the team, and And again, just empowering everybody to work at, in their skill sets and in their highest level of skill to provide all we can provide. The opportunities, what's possible is like the rose. That's what I get excited about, what we can work together to do. The thorn, just like any organization, I'm sure there's things that need to be, improved upon, but that's anywhere. And that's what we need to do. We need to see where there's growth, where there's change. I already understand that there's already started some changes as we've expanded and we've grown, as even COVID has come in to kind of disrupt what was. But now we are in a what can be and what will be. And that's what we're looking ahead and forward to do, is just, to bring, some good structure, organization, unify everyone around that common goal, that common charge. We may be at different centers and different places, but I think if we can unify around the common goal, we will definitely be successful.
That's fantastic. I mean, I can't say enough that when I hear your responses, it just sounds so much like, the fight dialogue and the way that we say things, the way that we present issues. And, I'm just beyond excited because I know that you're going to fit in quite nicely here, but let's be real though, community health, not everything is rosy, not everything is something, that you wake up every day and say, hey, sometimes things get tough. What are some of those recurring issues in community health? I mean, not to mention Philadelphia Fight, solely, but, in community health in general, what are some of the challenges that practitioners are presented with? And what are some of the ways that you think that you hope to address those challenges?
Sure. Common challenges, I mean, we serve challenging populations and populations of people that have major challenges, barriers, very vulnerable, have been marginalized, have been excluded. That brings a whole dynamic in itself. And again, it's about knowing and being aware and educating ourselves. I think one of the biggest things that makes an organization like this successful is educating ourselves about the people we serve, the people we will meet, the people we will care for, knowing their experience, knowing where they're coming from. I know sometimes we get a response that may not be favorable from those that we're trying to help, and that can be off-putting sometimes. But I had a conversation with one of our staff in one of my orientations, and she gave a really cool example. And just, you never know where somebody's coming from, what they just left, what experience they just had, what they're living in, what they're living with. And so that's one way to kind of address. I'm sorry.
I was just saying, meeting people where they are, that response.
Meeting people where they are. I think another challenge is sometimes there's not a lot of support for the work that we do, or the type of work, or the type of populations we work for. And so, and support may mean in terms of financial support, grant support. I know you guys are really well funded, but so, sometimes, there are limitations because of finances to what we can do. And so when we do work, the type of work we do, that tends to be a challenge or a barrier. It could be in terms of personnel, even support in terms of who's willing to, get with people and get again out of the four walls of a building, and really learn and know who you're serving, to be the most successful, even in the four walls of where you're serving. So I think those are some challenges that people face when we are working in community, and in particular those who are particularly at risk and vulnerable and marginalized, and may not have the same type of experience or resources or backgrounds that others may have that do have better health outcomes. And so there takes a little bit more to get them what they need and where they need to be.
I think that response is spot on. And if you believe it, we're 30 minutes into our talk now, and I had made a note to myself that at some point to make the pitch, and you hit the nail right on the head. We are a nonprofit organization. Just to reorient the audience, we're here speaking with you, somebody who we work very hard to recruit. But all of this stuff doesn't come without its challenges, especially without its financial challenges. So if there's anything that you've heard out there, anybody in the audience, anything that might compel you to give, go to our website. There's a link to donate at www.fight.org. And all the proceeds go directly into our organization to support not only our medical staff, but also the support services that are affiliated with Philadelphia Fight. So, I'm going to try to keep moving along. You've already touched on some of the things that I wanted to talk about, and that's health equity. So I just wanted to give you just a minute or two just to talk to me about, your view of health equity. And then from there, we'll talk a little bit about activism, and then we'll open it up to some questions and answers from the audience. How about that?
Sure. So we all hear a lot about health disparities, disparities. And I think we're starting to hear more about health equity, but what do those mean? And when we think about disparities in terms of health, it's those things, those determinants that cause people's care, people's health outcomes to be different in a negative way. And there are many different factors and influences. I won't just talk about barriers, but influences that lead to that. And it can be things that are very avoidable and things that are just inherent. But we do know that there are different determinants like socioeconomic status, gender, sex, sexual orientation, income, education, many things that may have someone else have a different experience for their health, whether it's the type of care they get, the options that they're offered, the outcomes that they have. And it's often rooted in some sort of discrimination. Many times that's not only overt, but covert and systemic. And so think about health equity. Again, health equity is achieving the highest level of health for all people. And how we really can do that is really addressing those needs, knowing what the issues are, what those factors are, and speaking and working towards those factors. Again, health is not just about access and healthcare delivery, although that's a large part of it. But we may even just think about physical environment. We think about people's employment status, where they, again, live, work, play, and trying to work to eliminate those factors that really prevent people from achieving their highest level of health. And that's what health equity is about. And you can't do it without, again, meeting people where they are, knowing the needs. And again, that's what I've been teaching. You gotta assess the need first. I know a lot of us are, we hear these things, we hear these problems, challenges, barriers, and we just wanna do. But before we can do anything, we have to understand, we have to know, we have to assess what the needs are. We have to know what has been done, what has not been done, what has worked, what has not worked in the past. What does the community need? What do they want to do? What will they be willing to work with you to do? Because it's a two-way street. We can offer and give, but they also need to receive. And so all of us giving what each individual or community or neighborhood or whatever it is that they need specific to them, that works for them. Because what works for them here may not work for them over here. And so providing, addressing those specific needs to achieve those highest levels of health is, that's what health equity means to me.
Again, meeting people where they are. I couldn't say enough what a great theme that is, because it really does, encapsulate just about everything that you've mentioned. Before we go to question and answers, I wanted to pivot a little bit and talk to you about activism. Philadelphia Fight has a long history of activism. It's in our DNA. You have to look no further than the formative years of the organization with ACT UP. Some of the folks in the organization that come to mind are, Val Sal, who's always been, an activist, who's always brought that activist spirit, who's always reminded Philadelphia Fight not to forget who we are. Asada Thomas over in the Institute for Community Justice, the work that she's doing, to advance the causes of folks who were who are involved in the criminal justice system, and folks who were formerly incarcerated. Even Dr. Stacy Truskin with the work that she's done in the Hep C world. I mean, literally changing the law in the state of Pennsylvania to be able to provide, an expanded access for people who are Hep C positive, and, folks who are able to be cured, So I say that because Fight, we're a very activist organization. So, what are some of those issues that that speak to you, and is there an activist in you somewhere?
So yeah, I mean, you've mentioned some awesome people, and I humbly don't know if I always can put my mindset that I'm an activist. And when I think about activists, in addition to those who you've mentioned, locally at Fight, and those, who are national activists, but when I think of activism, it's like taking action and fighting for those who may not be able to fight for themselves, or may not have the resources or the power. And sure, I mean, it's about advocacy. It's about helping people to get from A to Z. And sure, I guess when you think about that, I could consider myself an activist. But yeah, like I just, again, have always just wanted to be, it's all these cliche, you want to help people. Yeah,
Mhm.
I've always wanted to help people, but I again have always been drawn to those who need help helping themselves, and those who may be pushed aside, looked at differently, but have so much potential for their life. And if I can be an activist for bringing healthier lives to those who don't, that's, I guess, where my activism comes in. And again, empowering others to do so too. It's nothing like working with people in that common goal, and also teaching it. And there's something to be said. I give a shout out, maybe I have some of my former colleagues and residents on, but what I was able to bring at our residency program with Drexel, and teaching and expanding and building on community health to the point where it's not no greater testimony, where now I see my learners, my residents, my former graduated residents doing the things that I help them to see and get to and learn about and teach, and they do it on their own. I mean, at first it was, a push, okay, you guys do this. And there's a little fine line between, volunteerism and voluntoldism when you want to have learners learn about this work. But now we have a culture of community health. And that was one of the things that warmed my heart, that I was able to, okay, that's there now. I can move forward and grow from there and bring more from there, outside of that residency program, a bubble. And so, yeah, just teaching it, getting people galvanized around it, and
I
serving.
think
It's about service, and getting people healthy.
sure. I think that that's spot on. And something that you mentioned is, it's no doubt that you're an advocate, but the activist, that word kind of encompasses something that is far more deeper, and we're really excited again to have you, and to invite you to have a seat at the table. There's so many opportunities at Philadelphia Fight to get involved in so many different ways. And again, we can't say enough how excited we are to have you here. At this time, I wanted to again reorient the audience to to thank everybody for coming, and to let them know that we really appreciate the courtesy of your time. And if there's anything that you might have heard so far, please feel free to go to the website www.fight.org and click on the link to donate. Before we get to the question and answer session, I wanted to lighten the mood a bit. We've talked about some pretty heavy stuff. We talked about health inequity. We've talked about, pipelining. But at Philadelphia Fight, we like to have fun, and we like to invite folks to bring their whole selves to work. So tell us something about you, Dr. Gadegbeku, that we don't know.
Oh, I'm sorry, I have a train coming by. I love music. Music is like air, water, life to me. I just love it. I love sports.
On your playlist? What's on your playlist?
Oh, Jesus. All music. All music, literally, like, from all genres, from R&B, hip hop, I'm a kind of 80s child, to classical, to jazz, Christian worship, all of that. Like, I just love music. Everything I do is to music. I get ready in the morning to music. I work to music. And I come from a very musical inclined family. So I guess it was inevitable. And I guess another, fun fact about me is that I like sports. I actually was I taught, before I came to medical school, I taught ninth grade chemistry and coached middle school basketball. Probably not all know about that. So I really enjoyed the NCAA tournament. It was one of the best tournaments. If I have any NCAA fans in the house, that was one of the best tournaments I can remember.
UNC, Tar Heel, UNC Chapel, born and raised, born and bred. So college basketball is also a good time of year for me. That's as butch as I get throughout the year. Yeah. I'll say that. So I think that's really exciting to hear, and I know that throughout the health centers, folks share their playlists, that their Spotify lists. So, if you want to get to know Dr. Gadegbeku a little better, how about just sending her over one of your playlists and, letting her know a little bit about you that way?
Yeah, that would be awesome. I love that.
Yeah, I see here. I was going to invite Kyle Chavasta, who opened to help us out with the question and answer. But Kyle, I got over my my technical disabilities here, and I see the questions. So if it's okay, I'll just read a couple of them.
Absolutely.
All right, thank you. Dr. Gadegbeku, one of the questions that was asked is, do you have any advice for someone who is new to this profession on how to meet people where they are?
Sure. Conversation, communication, I think, is probably one of the biggest keys. It's something that we take for granted a little bit. And I know time, especially as a healthcare provider, can be a little bit of a challenge. You know, we're pressed and pushed to see people in a certain time frame. But I think sometimes the universe allows that time, whether it's through a no-show or whatever. But, you know, again, education and conversation, I think, are really two key things to help know the experiences of the people that you're serving. And, you know, asking those questions, asking, you know, taking the time. For example, if someone's not taking medication, what happened, what's going on, you know, and not assume why you think they may not be taking their medication. And that's where you start meeting people where they are and learning what are the issues, what are the barriers, what are the successes, what are the things that they were happy that they were able to achieve. And so, yeah, communication, conversation, education.
Fantastic. Someone asked the question, Patti LaBelle or Gladys Knight?
Ooh, I'm gonna have to go with Patty on that one. Sorry.
Oh, so you're real
Patty.
Philadelphia. You can't.
Philly.
Exactly.
But they're both icons and both great, awesome.
One of the questions that came through is, first, thank you for a clear and concise definition of health equity. Are there one or two particular measurable outcomes you would like prioritized as we strive for health equity at FIGHT? And that's coming from our research department. Lyndon Lally, who does a great job leading research. That question comes with that kind of perspective in mind. Are there any particular measurable outcomes that you would like prioritized here at Philadelphia FIGHT?
Sure. Well, I'm just learning what we all are doing and where our successes are and where our challenges are. I know I was given a few documents to review. And so there are some areas, but I want to say I'm still learning, so I know where to prioritize.
Sure.
But there are definitely some, I think general, again, FIGHT has done such an excellent job, and I saw some really great improvements and graphs on some of the care that we've given, particularly with those living with HIV. There are some general measures, and I don't know, I can't remember if they're for all or for certain populations or in certain sites, but there's some health screening areas that we can probably do a little bit better, particularly in the areas of obesity, diabetes, and maybe some screenings like cervical cancer screening.
Sure.
And things like that. But I'm still learning and definitely working to see where our priorities will be starting out.
Good answer. So what I'm hearing you say is, you don't want to criticize too much at this point, but I want to piggyback off that because I remember looking at your resume and your CV, and there was some work around diabetes, right? And promoting healthier outcomes for people who were living with diabetes.
Yes, some of my, I hope I'm okay. I see my internet may be a little unstable.
You're a little child. Hear you.
Okay. I know my residents probably will tease me too. I'm kind of like the diabetes go-to little bit of a stickler for people with diabetes and making sure we're looking at certain outcomes and measures for that. I'm also part of an organization new to Philadelphia called Cities Changing Diabetes. It's an international organization that actually we are the first, I think, second US city. The first US city was Houston. And then we are the second US city that has joined this initiative in Philadelphia, Cities Changing Diabetes. And, definitely one of my, I love to manage and treat and help those have better outcomes and live better lives with those with diabetes.
So I'm looking at the chat box, and we have a shout out from Dr. Mario Cruz, who said, hey, he's giving both of us a shout out. We have some folks who were commenting on Patty versus Gladys, and they said, why would anybody have to choose? So
right.
So, and a lot of the questions I think that you've already hit on, most of them are concerning health equity. One question here, what would you tell a little Black girl who wants to be a doctor? How would she navigate some of the systems that you had to overcome in your quest to be where you are today?
Yeah, number one, if I could do it, you could do it. And I know, you speak of my resume and all that, but I was not, top of the class. I was not, cum laude and valedictorian and all these things, but I knew how to work hard. I did have voices that, put doubt, are you sure you want to do that? You sure you can do that? And so if you see me, see you, that you can do it one step at a time, one day at a time. When a lot of people, they're like, oh, medical school, so many years of school, so much. I couldn't think about all the years that I was going to be in school. I really had to take it, sometimes one day at a time, sometimes a moment at a time. There are definitely some hard times, but if it's what you're called to do, it's what you're destined to do, it's what you love to do, it'll happen. And if you're a faith-believing person, you'll make it happen. A lot of what I do now, I never thought I'd be doing. I just knew I wanted to help people.
Right.
I told you I didn't go straight to medical school. I took some time and I taught and did something else and wasn't quite sure, but when I got there, I knew. But when I got there, that wasn't, all smooth sailing, but it was, if it's meant to be, it'll be, and you can do it. And, you will have people to support you along the way. Definitely for young people, take a hold of those opportunities where that are given to you, to be at the table, to be present, to shadow, to experience, to talk to those people that are where you want to be, and you can do it.
I heard a few things. I heard, being able to confront adversity. I heard you say being open to, receiving feedback and criticism. I heard you say, being open to the universe and, grounding yourself in faith, which leads me to a question that I hadn't thought of. Tell us a little bit about the village that it took to raise Annette Gadegbeku. Everybody has their support system. Everybody has, a family system. What are the origins of your last name? And, what was your upbringing like?
Sure. My last name is actually from Togo. The origins of Togo, my grandfather is originally from Togo, but my family is from Liberia, West Africa. My father is Liberian. My mother is African-American, born and raised in Washington, D.C. Have large families on both sides, but it's just me and my sister. Shout out to my sister, who is also a physician, had big shoes and always will have big shoes to fill. And I think that was intimidating at times, actually. My parents are not doctors. They are scientists, PhDs. My mom was a chemistry professor and teacher, and my father's a civil engineer. And she's going on, actually, she's right now transitioning out of being Division Chief of Nephrology at Temple University. She's going to be
Wow.
the first Black chair of nephrology at Cleveland Clinic. So, you know, I'm little G, she's big G. So I give her a shout out. And I have a large family of cousins and aunts and uncles, particularly on the father's side, very brilliant people who, you know, supportive, but can also be, again, intimidating. But I think that fight, and it's cool that, you know we talk about activism and fight, and those that kind of really know me know I do have just a little bit of fight in me. So I'm a little bit of a fighter, and that comes from, and I believe that comes from my origins. Actually, my name, there's two translations. No matter how great you will die, but only the strong survive.
Wow.
And so I come from survivors, and that's definitely in me. And so my village definitely has been family. Though my colleagues, I have a long-standing relationship with those that I just recently transitioned from, but a lot of the colleagues, my closest colleagues I worked with for anywhere from like 13 to, I've known one of them since I was in high school. So definitely have some support there. Yeah, that's my village.
We've got some comments here. There's a Susan Cosgrove in the audience who says that Dr. Gadegbeku is one of our city's changing diabetes superstars, and we're so lucky to have a team. So a little shout out there. And I have a question here from our CEO who is in the audience. She writes, I think a lot of our staff are dealing with the long-term effects of being on the front line of this pandemic and on the front lines and helping with many very disenfranchised people. What strategies do you recommend to avoid burnout among people who do this important work?
Wow, that's a deep question, and definitely very real. We're all struggling with the effects of going through this for a long term. And some of us, even some me and my colleagues, some other added factors with, instability of our hospital institution, the closure of Hahnemann Hospital for like now, the combination of the two for almost 2 years. And so definitely have witnessed, observed the effects of these traumatic events in our social injustices, social unrest in our city. It's COVID, and COVID has been extremely influential in people's mental and physical health. And then on top of that, we've had some major influences, including social unrest, violence in the city. And even though those things might not be at the forefront, they're definitely in the background for all of us as healthcare providers, as we hear it and see it in the background. And so our well-being is important. And first acknowledging that that is important is first step. And taking the time when we can for self-care, and self-care physically, self-care mentally. We are all struggling with, stress, anxiety, depression, isolation, finding ways to build community in these different type of times is very important. So taking time for yourself, taking time to be with people that you know and love in whatever way you can. And I know as people are becoming vaccinated and hopefully opportunities are more possible, and having our colleagues and those that we work with and work for understand what our challenges are, support us in that, I think is very important, in whatever way that they can, how that looks in our respective sites, organizations. But nobody's going to take care of you like you first.
Right. I think that sums it all up. As we wind down, I always like to share with the audience, some further readings that they can have in order to get a better grasp of some of the issues that we've discussed today. And one of the books that I always mention is called The Good Doctors, the Medical Committee for Human Rights and the Struggle for Social Justice in Healthcare. I'm completely fascinated by racism and, anti-Blackness in the American healthcare system. And this book, The Good Doctors, if you are interested in learning more about the connection between community health systems, community health centers, and the civil rights movement, this is a great place to start. It's a very little known fact that the civil rights movement was very much involved in the community health center movement and where we are today. The Medical Committee for Human Rights were a group of industrious doctors from the Northeast, many of whom were white and many of whom were looking for ways that they could get involved in the civil rights movement. And they found themselves down in the Deep South on the front lines when, there were instances of resistance. They were always there kind of being medics, if you think about this as war. They were on the battle lines. They were providing healthcare to folks when the dogs were sick on them, when the hoses were out. And there was a time during the movement where the tenor kind of changed. And, it wasn't so much in line with the end goal for white doctors to have so much of a say in what was happening in the civil rights movement. So what they did is they went to the leadership and they said, what can we do? And the leadership said, go home, go back to where you came from and share with them, the importance of universal health care. Share with them some of the narratives that you saw down in the Deep South, down in the deltas of Mississippi, and, and to kind of create a movement in that respect. And from that movement came the Community Health Center, movement. You might hear folks talk about Jack Geiger, God rest his soul. He passed away last year, but he was one of the first folks to really apply for a grant to open a community health center. And it really did come from the civil rights movement, from this notion of universal health care, from this activist movement, that we talked about. So it really does feel full circle for us here at Philadelphia Fight, or I can speak for myself, having, only been here for 4 years, to kind of see that progression and to see those connections. And it really, I think, inspires all of us to really bring our best selves to the work, no matter what we're doing here and, what our responsibilities are. So that's my little call to action. It's The Good Doctors by Charles Dittman. And by John Dittmer. I want to give you the last word. We're winding down here. Dr. Gadegbeku, we have, put a lot, we're investing a lot in you. We put a lot on your shoulders. My question to you is, what do you need from us? What do you need from the Philadelphia Fight family? What do you need from the providers here? What do you need from me as a colleague? What can we do to make sure that you can bring your best self to the practice here?
Wow, that's a great question. First of all, thank you for having me. Thank you for welcoming me. Everyone that I've met so far, if you're on, thank you. Everybody's been so nice, so gracious, so welcoming. And that's the first step, like just being so well received has been huge. And you all may not know how big that is for me, just coming just from a little bit of what I've recently been through in my previous position, and not to say that definitely is a great experience being there, but we definitely, if those of you who know what my previous organizations have been through, it's just been tough. And so the warm welcomes, the expressions of just being excited is definitely going a long way to help me come in. And then my only just request is for everybody to also be their best selves and again, know how much everyone is so valuable, how valuable everyone is valued. And I hope I can continue to foster that sentiment across the organization. But I think if we all work at our highest levels of excellence in our respective roles and positions, it doesn't matter what you do, who you are, if you're a provider, staff, administrator, supporter, it all is important work for helping people achieve health equity, living their best life, having their healthiest life. We all affect people's lives in some way or another. I just can't express that enough. So if we all just kind of work at our highest level, our highest skill and excitement and sincere passion, which I no doubt is here. I can see it, feel it, hear it. It'll all make all of our jobs easier to achieve the goals. And so that's all I'm asking. I can't ask for much more right now, but I'm so grateful and thankful for y'all having me, welcoming me, receiving me, and even having me on this conversation today. So thank you.
Thank you so much. I mean, I just want to leave it there. Like, we could literally just shut down everything right now, get all going about our days, renewed in the notion that, you are welcome, that you have a seat at the table, that, we're very excited about bringing you on board. This is not lip service. This is, genuine 100%, excitement and admiration for the work. And, now let's get it done. I want to thank you again. I know that you probably have a lot on your plate. You're 4 days into the work, and maybe you can have some free time today since you didn't have much time to transition from your last role.
No, that's okay. There is one question in the chat I just want to address. I don't want to miss that, but
Okay, can I think first about this? Is this Sheila Pittman?
Yes.
Yeah, that's my sister from North Carolina. She's a social worker.
Oh,
so
hey, sis.
Yeah,
I'm sorry.
I'll let you ask the question, or how about you answer it? She says, as a social worker, I love the title of meeting people where they are. This is the preface and guideline for providing social work services to people in any arena. Glad this is how you approach your work when working with the clients at FIGHT. My question is, how do you suggest that social workers and others working with people during a pandemic take care of themselves, not just in regard to the mental health concerns, but their physical health? So this is a question piggybacking off of what our CEO, Jane Shaw, asked earlier about, how to avoid burnout. But Sheila's question, I think, is more specific with regards to physical health. Do you have any advice for maintaining good physical health during this very difficult time for everybody?
Sure. So I guess the obvious answer, people think about is physical health, you can exercise, right? And so, whatever you can do, whatever you're going to do, don't set goals like, oh, I'm going to run 5 miles every day, and that's not possible. So realistic, physical health goals. But when, something that I think, and that is why I wanted to address it, because I think it is actually really important for us, especially for those who are who are providers of care, whether that's, specific medicine or social work or whatever, in a pandemic, is rest, sleep, eating healthy, just healthy habits, those things that we take for granted, but rest, which I know is a commodity, but I think just being aware of how important rest and sleep, actual sleep is, the hours that you get, that feeds into everything, our mental health, our immunity, just how we operate physically, mentally, emotionally throughout our days. So taking important precautions for our physical health is really important, and getting that exercise in when you can. Those walks is starting to become very nice outside. Getting that air and getting, that oxygen to the brain in whatever physical way you can, that's realistic. And yeah, but I just wanted to highlight that rest. And, that's something I will say I'm admittedly working on, and is not something that I've have achieved excellently, and by no means, but it's definitely on the radar. So, and I believe it feeds into every part of our well-being that we often take for granted.
Great response. And, I'll say to Sheila, who asked the question, they're on spring break right now because she's a school-based social worker. So get out and get some fresh air and take my nieces, Taylor and Whitney, with you. How about that? Anything else? We've got about 10 more minutes here. I had this plan to give you the last word, and I want to commit to that, so, come on. That was one more thing.
Another last word?
Yeah, you question. I was ready to go, ready to let everybody.
That was my fault. I don't want to feel anybody left out.
So go for it. Last word.
Last word. Let's do this. I'm ready to do this. I'm ready. I've joined the team, and one of the things, again, I said I love sports. I didn't say my first love is football, but anyway,
okay.
We're a team. Let's do this. Let's achieve what we are all called. I believe everybody at Philadelphia Fight is called there for a purpose and a plan and a reason. So let's
preach.
Let's do it.
Preach. Let's do it. Let's do it. Thank you so much, Dr. Gadegbeku. This has really been exciting. We're already at 1:20 p.m. and it go on and on and on, I feel like. So, and I'm looking forward to working more closely with you and having more candid, in-depth conversations about these very important issues, and even about a little bit of college basketball. How about that?
Okay, sounds good. Right.
Thank you so much. So officially, that was the last word. But for those of you who are interested in hearing more about what we have going on for the rest of the month, I encourage you to join us back here. It's every Thursday at noon. We've got some really innovative and exciting programs for what we are calling Philadelphia Fight's inaugural Health Equity Conference, meeting people where they are. Thank you so much, and stay tuned in to us throughout the rest of the month for the event. How about that? Thank you.